Good morning. It is Friday, October 7th. We are wrapping up Pink Week in observance of the start of Breast Cancer Awareness Month. I'm Jessica Lovell. Coming up today on the Morning Medical Update.
I struggle with telling people about my diagnosis because, again, for me, it felt like this was not supposed to happen to me.
This vibrant, successful woman got the news no woman ever wants to hear. We're going to tell you how her breast cancer diagnosis sent her in search of a second opinion, but also down a dark path. Meet her and the doctor who guided her along the way. The overall public isn't, but scientists say they are concerned about a more dangerous variant of SARS-CoV-2 developing. Should we worry? We'll talk more about that. And it's Foodie Friday, so we're back in the kitchen with Chef Eric. He's got a great recipe ready just in time for the weekend. Thank you for joining us here on Facebook, YouTube, and on Twitter. We are live inside the Dolph C. Simons Jr. Family Broadcast Studio. Get your breast cancer and COVID questions sent in to us. Use the links right there on your screen, or as always, you can post them in the chat below. We'll get to those in a bit. The power of a second opinion in breast cancer and where you receive it can be laid out like this. For women who receive a second opinion from an NCI-designated cancer center, 43% of them had a change in their specific type of diagnosis. For others, a second opinion brings a peace of mind that the original diagnosis is accurate and the care and treatment that they're receiving is the best option. That was the case for Shalina Prude. She remained hopeful during her breast cancer diagnosis, but also faced some really dark days.
Not only did it represent an example for other women, it's also an example for myself.
Shalina Prude never planned on being the face of breast cancer.
I struggle with telling people about my diagnosis because, again, for me, it felt like this was not supposed to happen to me. You know, I have a master's degree, I'm educated, I have this great career, you know, I'm going places in life. This diagnosis was not supposed to happen, to me.
A diagnosis she feared after finding a lump in her breast during a self-breast exam.
I was on such a high because of all of the positive things that were occurring in my life, at that point. And so once I received that diagnosis, it was literally like the wind had just been swept out from up under me. But I literally just sat there and bawled. And then I remember starting to call out to family members and to confirm my diagnosis.
Doctors at the University of Kansas Cancer Center diagnosed Shalina with stage 2A triple negative breast cancer. Shalina opted for a second opinion at a cancer center in Houston.
It was a very rare type of cancer. Again, it was really difficult to treat, and they needed the second opinion in terms of how to treat that type of rare cancer. I had a physician speak to me and tell me that it wasn't a death sentence. And I think after I talked with that particular physician, I came out of it with a vengeance to fight.
A decision to fight that didn't come without bouts of depression.
I do remember telling my aunt that I wanted to take my own life. It was a very dark moment going through the cancer, the treatment. I felt like I literally wanted to take my own life. I joined a support group of amazing women who helped me get over the hurdle. So when I needed to talk about symptoms and diagnosis and treatment, they were right there.
Years after being diagnosed, Shalina is cancer-free and thankful for the support of her family. She also fully understands the importance of self-breast exams and second opinions.
Thanks to a second opinion, I knew I was in the best hands at the University of Kansas Cancer Center.
And Shalina joins us live this morning along with her breast surgical oncologist with the University of Kansas Cancer Center, Dr. Jamie Wagner. Welcome to both of you. And it's
Thank you.
Somewhat of a reunion. You two ladies haven't seen each other for what, 2 years? Is that right, Shalina?
Or maybe a little bit more, maybe a little longer than 2.
Yep.
It's been a while.
It has,
Yeah.
But that's a good thing.
Yeah.
Because that means she's doing so well.
Yeah, exactly. The less
Yeah.
we see each other, the better sometimes. Shalina, you were diagnosed with breast cancer almost 10 years ago. We were talking the other day, and you said that these milestones, no matter how big or small, they mean everything. How are you doing today?
I am doing so well, and you're absolutely right. When I joined the breast cancer support group years ago, one of the ladies in the support group always said to celebrate every milestone. So yeah, up and coming, almost 10 years of survivorship, and I'm grateful. I'm doing well, and I've started a new career recently in software and product, and yeah, and it continue to move forward. I'm still an avid traveler, as you see from some of the pictures. And my family's doing, has their health and are doing well. So I'm just more than grateful for Dr. Wagner and the University of Kansas Cancer Center for the amazing life that I still have.
Well, you look fantastic. Dr. Wagner and I were saying while your story was being played, I was like, she's just beautiful.
I know.
Isn't she?
Absolutely. And she just glows.
You glow, absolutely. Well, all week we've been talking, this Pink Week, we've been talking all things breast cancer. And today we're really focusing on that power of a second opinion. You sought a second opinion at MD Anderson in Houston. You ultimately received your care back here. Tell us about that need for a second opinion. And I know Dr. Wagner had a lot to do with that second opinion, but tell us about that journey down south.
Absolutely. So, Dr. Wagner, thank you, first of all, for your amazing expertise and skill set. And I wholeheartedly, once I became a patient of yours, I wholeheartedly believed in you and everything that you were doing for me. So thank you so much. The second opinion came from Dr. Wagner, actually. And yes, she suggested that I go see a physician at MD Anderson, because that particular physician had a subset specialty, or she was a specialist in I believe it was metaplastic breast cancer that I had at the time, and was diagnosed with. And so I was happy to definitely go to MD Anderson. When I did arrive at MD Anderson, I'll be honest though, I felt like I was just a number in many ways, because the hospital is such a large facility. Here at KU and at home, I felt, very well taken care of. I was special. I was one patient with this subtype of breast cancer, and I felt like KU really met my needs in that specific area. When I did go to MD Anderson, what was nice is that the procedures and treatment protocol was on par with what Dr. Khan and Dr. Wagner had suggested as well. So I was really grateful for the second opinion in that sense. I also believe that a second opinion helps you to solidify the information. Initially, when I, talked about my breast cancer diagnosis, I had my mom in the room, my best girlfriend in the room, but there was a lot of information being taken in at the time, and I don't believe a lot of it I absorbed as much. And so the second opinion helped to solidify that information. I still had my mom in the room as my support system when I had received that second opinion. Also, another a family friend of ours was there as well. For me, the second opinion helped me to solidify, helped me to listen further, to understand my diagnosis in a deeper way. And from that, I do remember sitting in with that particular physician in the hospital room, and I remember feeling encouraged. I remember feeling courageous at that point, because initially, of course, I felt like my diagnosis was a death sentence, and it was daunting to receive. But once I got in that second opinion and could hear the information and hear the protocol that was put in front of me in terms of my treatment protocol, I really began to think that, I could do this. Here I am. These folks are helping me upon this journey, and I can, make the difference and come on the other side of that. And so it was encouraging, was vital information that I needed to hear. And from there, I was able to come back to Kansas City with a different feel about my protocol, my breast cancer protocol and treatment.
Yeah, you came back and Dr. Wagner was waiting for you, Dr. Khan as well. And Dr. Wagner, I know sometimes we are the second opinion for patients that come to us, and then we often send people for those second opinions, or patients may ask for one. But why is that such an important step in seeking the right treatment?
There can be two different aspects as to why that second opinion can be important and beneficial to patients. First and foremost, as Shalana just illustrated, hearing the information the second time gives you an opportunity to absorb the information maybe to a different level. You're not quite in shock at that second opinion consultation. But the other reason that is of equal, if not of more importance, is that we know that in particular, when getting a second opinion at an NCI designated cancer center for breast cancer, 43% of patients will have a change in their diagnosis or treatment. And we have come so far in breast cancer treatment in making survivors, but it really relies on getting the right diagnosis and therefore putting the right treatment plan together. And that second opinion can sometimes offer that change.
When you say a change in diagnosis, that 43%, what do you mean by a change in diagnosis?
So as a result of a lot of second opinions at NCI designated cancer centers, we take a look at the imaging that was performed outside of our organization, and maybe there's additional imaging that needs performed, and we have seen that. Specifically at our organization and within our breast cancer program, 70 to 80% of patients have at least one additional image taken as part of their consultation. And that helps round out. We might find additional cancers, find that the cancer is larger. So that in and of itself can already modify the plan.
Yeah.
But it's also embedded in pathology. Pathology is so incredibly important. That is the foundation on which how we build breast cancer treatment today. And by having a second opinion, especially from a specially trained pathologist, this has been shown in the literature, that it also can, between 20 and 50% of the time, change the diagnosis. And if we don't get the platform right, we're never going to build the house on top of it correct.
So triple negative breast cancer accounts for about 10 to 15% of all breast cancers. For folks, we've talked a lot about the different types of breast cancer there are. Specifically, what's triple negative mean, and who's prone to it?
Well, triple negative breast cancer is one of the many types. And I think the important thing to really understand about breast cancer is, as I explain it to my patients, breast cancer is like a family of cancers now. Fortunately, we've advanced a lot in our understanding of breast cancer and understanding that it is a family with a lot of different personalities. So just like every family has a lot of different personality types and they respond different to different environments, that's what we understand about breast cancer now as well. So the different types of breast cancer need to have different treatment plans. As far as the sequence of treatment, are we going to do the medication side or the surgical local side first? But also the specifics in particular on the medical, the systemic therapy side. That is so tailored according to that treatment or according to that breast cancer type. Triple negative breast cancer, we do see more in African American women. We see it with, in particular, like BRCA1 genetic mutations. But it doesn't mean that those are the only women that will get breast cancer. We can see it in a lot of different women of different ages, different cultures. So it can impact really anybody.
Yeah, hard to imagine decades ago where we just treated breast cancer one size fits all, one treatment fits all, and how outcomes would have been so much different had we known then what we know now.
Absolutely. My analogy is we used to throw spaghetti at the wall and would see what would stick.
See if it sticks. I want to talk about screenings. There's been some new recommendation for screening for these certain type of cancers. You don't screen for all, but talk about that a bit.
So from a genetic testing standpoint, we know that there are certain times and presentations that would have a higher probability of having a genetic mutation that could be contributing to the development of breast cancer. Recommendations actually have recently changed. So any woman that comes in with a diagnosis 50 years or younger, and so that has actually gone up just a little bit. It used to be 45. So if you have a diagnosis at the age of 50 or younger, you should really have genetic testing. Any triple negative breast cancer at any age should have genetic testing.
And then what would that tell us? Is that trying to tell you what's going to happen with your children?
Well, there's a lot of different things actually now. One is that cascade across the family. So if a woman does have a genetic mutation, then it's an opportunity for the rest of the family to undergo testing, and maybe we can prevent through risk-reducing strategies somebody else getting a cancer. But it also has advanced on the treatment side. So patients that have genetic mutations, like a BRCA mutation, there are specific medications that we also want them to have the opportunity to receive that improves outcomes.
Shalina, as we saw in your story earlier, you've been very open about your mental health struggles during during your diagnosis, during the treatment. I want to talk about that. And also a question is, did you suffer from depression before, or was this brought on merely by the cancer diagnosis?
No, it definitely was brought on by the cancer diagnosis. I, live very positively normally, but prior to that diagnosis, yeah, it was just very daunting and really, I had some really dark moments. However, I did find during my cancer journey, also, I found a lot of positive moments. So I would, exercise in my community and walk and get out and just let the sun shine on my face. And that really also made a difference in my mood and behavior as well. But there were a lot of dark times too. And through those, I would sometimes suffer in silence. Sometimes I would phone a friend. Sometimes I would pray, just depending on, what was going on at that time. Yeah, my mom and my aunt, as you see there, were, very instrumental in a lot of my journey and helping me to get through, some of those darkest and deepest times as well.
Yeah, the extreme of considering suicide during this time, it certainly paints the picture of what these women are going through. But Dr. Wagner, what I love about her story is that even when she just said the sunshine on my face, trying to take control back and try to do those little teeny things to pull herself out of those moments and I think, Shalita, you said it was like, I just needed to get through one more day, make one more phone call, and it got you there.
Absolutely. Yep. My at the time that I mentioned wanting to take my own life, I think were the exact words that I used. My mother and my aunt were present at that particular day, and specifically in that moment, they lifted me up in words and encouragement and told me how much my life meant, and that actually shook me out of that mental state in that moment. And so I think it is important to surround yourself with positive folks all the time, have an amazing support group. I will say that is probably one of the most critical components of getting through a breast cancer journey, is to have a social support group or a support group in general that really lifts you up and encourages you along the journey. And that for me made the difference. Those two women are they're my heroes.
Yeah.
And they're incredible forces in my life as they still are today. And so without them, I don't know if I would have been able to make it. And so for me, they are my rock and were, critical in me overcoming the journey.
Shalita,
Sure.
we had the pleasure of meeting some of your other support group members earlier on in the week, the Kansas City Pink Warriors. We're going to talk a little bit more about that here in just a moment. But let's get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count and some COVID headlines on this Friday. Good morning to you.
Hi.
Hi.
Yeah, happy Friday.
Yes, right?
Right now, 28 active infections in the hospital. Again, it's been down. Hopefully we can continue to go down. Really need to look at that 7, 10, 14-day average. Of those 28, 3 in the ICU and 1 on the ventilator, still 20 in that recovery period. But again, as we know, nationally, cases are going down, but still the running 7-day average is 35,000 reported cases. Obviously, we know that people are either not testing or testing at home, so that number may be skewed just a little bit. But also hospitalizations overall are going down, although still quite high.
All right, for those who may be hearing this for the first time, scientists say that they are worried about a more dangerous form of SARS-CoV-2, some different variants that may come, but most Americans aren't that worried.
Yeah.
This is according to a new Pew Research survey. So should we be worried? Are you worried?
Yeah, I'm not too concerned right now. Again, I think we have the vaccines that continue to work. Remember, really what we hear about in most of the news studies when we hear about waning immunity or decreased immunity or resistance to vaccine, they're really talking about those specific antibodies. But we know even the original monovalent vaccines that were produced, those mRNA vaccines, continue to have you develop immune responses and antibodies even to those variants you haven't seen. Now, they might not be high levels of that antibody, but more importantly, you have those T cell responses, and those are really what are needed to help reduce your risk of hospitalization and severe disease. And the best data, the best information we have is that on the spike, there continues to be about 80% or just a little bit more of conserved areas of those spike that our T cells can still respond to. So I think in that way, I'm not too concerned. Am I concerned as an ID physician who understands that viruses can change, can mutate, can have differences? Certainly, I think we need to continue to be on the lookout for those, but right now our vaccines continue to be fairly high efficacy for reducing that risk and developing those immune responses. So it's most important to stay up to date and get those booster doses if you fall into that criteria, if it's been several months or it's been a few months since your infection. We also continue to have Paxlovid and remdesivir, which are our antiviral treatments. Again, getting treated earlier is better. Always have concern about viral resistance to any drugs, any antivirals we may have. We need to continue to be on the lookout for those, but otherwise not too concerned in our current clinical state.
Some news out in Overland Park. The Deanna Rose farmstead closed temporarily as they euthanized birds at the farm because of cases of avian flu. How concerned should people be? Is this to protect the people or is this to protect the other animals?
You know, it's certainly both. So it is certainly to protect the wild bird flu, but the wild bird flu bird populations, but also those commercial and farm bird populations as well. Certainly there can be some instances of human infection, but those are extremely rare. Those are also in those people that are working with fowl and birds, so it's important for those people to do protective measures, you know, wearing eye protection, wearing masks, things like that. But I think it is concerning. It has an impact not only for our wildlife, but also those commercial entities that help provide us with food, such as chicken farms and things like that.
Dr. Hawkinson, thank you. Let's check and see if there are any reporters on the line. Well, then let's get to it. We've got community questions. Sandy wants to know, Dr. Wagner, she heard the average age of breast cancer in women is 63. Is that accurate?
Yes. When we look at breast cancer, the most common time of onset is in the 50s, 60s, and 70s for women.
Are people, how are people doing with their screenings? We know COVID had a big effect on people putting things off, but where are we at with that? Are we seeing any of the effects of delayed screenings with breast cancer?
I think that we have seen an improvement probably in the last 6 months.
Okay.
But yet I still think that there are patients who have not gotten back to that routine. And, you know, at first it was because we shut down. Patients were concerned about coming back out, especially into hospital facilities where we were treating COVID. But now I really think it's a little bit in part because they got out of the routine, right? I have one patient that I love what they do is she brings about 3 or 4 of her girlfriends and they come in and they make a day of it. They go have lunch, they get their mammograms, and they go shopping. But it is an annual event for them. And maybe rallying together as groups and encouraging other women in your life and doing it together would help women really get back to that screening that's needed.
Okay, so I do have a question from Isaac wants to know, what types of breast cancer allow for early hereditary screening? You mentioned it earlier, but can you mention it again, just so people know if they need to come seek you out?
Right. So as I had mentioned, women that are 50 years of age or younger that have a cancer diagnosis, women who have a triple negative breast cancer. We now know that patients that have lobular carcinoma, in particular lobular carcinoma with a family history of diffuse gastric cancer. Also, patients, we want to look at patients' family histories because if the patient has breast cancer, or to be honest, even if you're in your primary care doctor's office, know your family history because there are certain other types of cancers that can be linked from that genetic mutation standpoint to breast cancer, and those should be tested. Specifically, we look at ovarian cancer. All ovarian cancers should undergo genetic testing, pancreatic cancer, and metastatic and high-risk prostate cancer, as well as male breast cancer. So if we see a patient with a primary cancer with that family history, then we want to test them. But it's also important, what you had mentioned a little bit ago, is knowing your family history. Can somebody be tested before you get cancer so that you have the opportunity to avoid being in that situation?
So Tiffany read a study that excessive sitting can double risk give you the double risk of breast cancer for women. I would imagine that's related to overall activity and health, but let's talk a little bit about diet, exercise, and again, some of those things that you can control in your own health to stay out of that lane.
Absolutely. We do have a little bit of control.
Yeah.
And the area specifically is a sedentary lifestyle for all cancers. We know that all cancers, but particularly breast cancer, we see higher risks with obesity. So having a very routine part of your lifestyle being some type of exercise routine is extraordinarily beneficial because we want to maintain a normal, healthy weight. We also know that that then goes into nutrition. Not having diets really high in like those fatty red steaks, those types of meats. It doesn't mean you can't ever have a steak. And that's what I also tell patients. But maybe we shouldn't have a steak every night of the week.
Yeah.
Right? And then the other thing is alcohol intake. Again, it doesn't mean you can't ever have alcohol, but how much are you having? And when we see an excess, definitely of what would be like 8 a week, we can start seeing an increase per what literature has previously shown.
Good reminder. Okay, Shalina, you also focused on exercise as part of your recovery. We talked to members of the Pink Warriors. They were on our program on Tuesday. And you joined this group, this dragon boat racing group. Tell us how working out with them physically and emotionally and spiritually, how here you are. This was actually a week before the pandemic hit. You guys were out at the Sports Performance Center and there you are hitting it hard at the gym. So how important was this for you?
This workout with the ladies is everything. It literally, I heard one of the ladies, Jen on the team, say one time that dragon boating was her soul food, and I can completely agree. It is just phenomenal to work out with the ladies, to train hard with them, and we have been successful in winning quite a few races and taking the gold. They're just, it's incredible. We came from, I would say we started out as not very athletic when we started the team to these phenomenal athletes that we have come to be. And it the ladies that suffer from maybe lymphedema, they are able to really work through that with dragon boating, as well as, for all of the ladies who have had some type of cancer diagnosis. Really, it's a team for cancer diagnosis for women, not just breast cancer. So if you suffer from some type of cancer and have gone through the cancer journey, it's really an amazing workout, keeps you physically active. We practice 3 days a week. And then the races are all through the summer that we attend. So they could be in Oklahoma, they could be in Iowa, or there was one recently scheduled for Orlando. So there's an opportunity to travel. There's an opportunity for camaraderie and sisterhood and community, and just really continuing to lift one another up, whether or not you're going through the cancer journey or not. And there are some of the ladies still on the team going through metastatic breast cancer and other types of cancer through the journey. And so we want to continue to be that community as well and continue to lift one another up and be that social support group. And so even though I don't have the Wednesday support group that I used to have, going to that when I was diagnosed, I still have this amazing group of ladies who are part of a larger community to serve not only the breast cancer community, the cancer community, and also we do a lot of community service. So there's a lot of components in this particular team that you get, and it's not just the physical activity, but it is, I would say, many aspects of it for overall life and health, and kind of continue to help you continue to push forward. The physical activity, though, is spot on. It is a really hard workout. And I do the dragon boat, I do that 3 times a week in the summer. And then I also continue to work out and eat well and do a lot of the things that Dr. Wagner just mentioned, which was limiting meat in general, really eating a lot more fruits and vegetables. And I exercise on a personal level about 3 to 5 times a week. So I do try to stay pretty active as well.
Looking good and feeling good. 2 quick questions before I get to our final thoughts. Joellen wants to know, what about different kinds of mammograms, 3D mammograms and things like that? What should people know about how that has advanced? Dr. Wagner?
Great question. We have come a long way with mammography, from analog to digital, and now where we are is 3D mammography. And we absolutely advocate for all women undergoing 3D mammography, what is also known as tomosynthesis. It helps with women who have dense breast tissue, but just overall, it's a more comprehensive mammogram. At University of Kansas Cancer Center, we feel so strongly about this that the few insurances that do not cover this, we write it off. We don't care. We want patients getting the right imaging so we can diagnose early.
Wow. I like to hear that. That's for darn sure. Sandy wants to know, my mom and both of my sisters had breast cancer, but there's no BRCA gene in our family. Are there more genetic links able to be tested for today?
Absolutely. We used to only be able to check for BRCA1 and 2, but now we do panel testing and test for, most commonly, at least 25 different genes. Now, it's important to understand that within those 25 genes, it does not mean that all of them mean you have a high risk of breast cancer, but there might be just some loosely associated breast cancer risk with it. But some do have more actionable mutations that we want to be proactive.
All right, let's get to our final thoughts today. Shalina, before we let you go, again, thank you for sharing your story. We always appreciate our patients being open and willing to share their journey with their health. So thank you for that. Always good to see you. And just your final thoughts as we head into the weekend.
I would say to those ladies that are hesitant about getting a mammogram, this is Breast Cancer Awareness Month. Please make sure that you get out and get a mammogram, as it could definitely save your life. I am grateful to Dr. Wagner. Jessica, I'm grateful for you for always thinking of me and having me on the show every now and again. I like to, do as much advocacy as I can. So thank you for giving me this platform to be able to do so. And ladies, please definitely take the steps to get that mammogram, as it could certainly save your life. It certainly did for me.
Thank you for being an advocate, and you're welcome back any old time.
Thank you so much.
You bet. Dr. Wagner, final thoughts.
I really have 2 closing thoughts. One is, be your own advocate, and that is what has really helped Shalina in such a successful story, is if you feel something, make sure that somebody is not overlooking it or writing you off based on your age or whatever other reason they may want to give. Get that worked up. And with that, get your mammogram, but know your breast density, because we need to be doing supplemental screening when women have dense breast tissue. And I think that Katie Kirk's recent diagnosis has brought that to light significantly, and we have a full dense breast program here, so we are very strong supporters of that supplemental screening. And then the other is mental health. I really appreciate Shalina bringing this to light, and we know that at least 30% of our breast cancer patients suffer from depression, and even more from different levels of stresses and anxieties. And that is not a sign of weakness. We want to talk about that. We want to get support. A lot of times patients are afraid to say something because they're going to be labeled, but you have a critical event in your life. It doesn't mean we're going to medicate. We want, very much like what Shalina experienced, have the conversations, find those things that get you through that next day, and find that support system, and that's what we want to offer.
Great message. Thank you for ending on that. Appreciate it. Always good to see you.
You too.
Dr. Hawkinson, final thoughts today.
Yeah, again, thanks to our, all week, our brave guests who've been through so much. Also, thanks to our medical teams and, of course, our physicians who help care for these patients. I think we need to continue to re-endorse the fact that we've already heard about, prevention. So prevention, get those vaccines that can prevent morbidity and mortality. Do those preventive screening procedures such as colonoscopy and mammography. For all of our audience, this is an easy audience to reach, but please, for your friends and family and loved ones, tell them as well. Get on their case to do those things, because overall it will continue to lead to a better quality of life.
Great. Dr. Hawkinson, thank you so much. Well, it's Foodie Friday, and as temperatures start to drop just a bit, it's time to switch up those fall recipes. Here's another great one from Chef Eric King. Everyone, have a great weekend, and we will see you live from Arrowhead Monday at 8.
Hello, thank you for joining me. Today we're going to be making a garlic chicken penne pasta. Nice thing about this recipe is you can cook your chicken out on the grill ahead of time and have it ready to go. We're going to be doing a lot of work today over here at the stove, so if you don't mind following me, we're going to step right this way. Thank you. All right, we're going to start our recipe off with a little bit of olive oil. Pre-warm skillet, we're going to be sauteing some zucchini and some mushrooms. Zucchinis are full of carotenoids, nice and healthy. Nice thing about this recipe is, over the years, pasta's gotten a lot of bad press. It's not a healthy diet, but you can incorporate it in with a lot of vegetables to make something that's nice, healthy, and filling. So while we're sauteing all these guys here together, we're going to whisk a little bit of a low-sodium chicken broth and some flour together. And we're going to get that started in our second saute pan. And we're going to add in some fat-free cream cheese. Now, if you like your dish a little bit creamier, you can always use a low fat, but for today's recipe, we're going for the fat-free. We're going to add in a little bit of salt and pepper and some fresh garlic. Oh, I love how that smells. Well, we're letting that saute. We're going to go ahead and get our cream cheese going here. To save time, while we were grilling that chicken, we went ahead and cooked off our pasta ahead of time, a nice little penne pasta. You can also use a whole wheat pasta for a little bit healthier variety. We're going to turn that down just a little bit. And we're going to add in some of our penne pasta noodles. Now, as this cream cheese is slowly melting, we're going to add in some diced sun-dried tomatoes. A little extra flavor right there. And once we get all this all put together, we're going to add these two and finish off with some sliced grilled chicken. Look at that really coming together now, slowly melting in there. That little bit of flour there with the chicken broth is helping it thicken up real nice. Now we're going to add that in here. Get that all stirred up real nice. Mixed in really, really well. How's that look? I think we're ready to go here. Now we're going to throw that on a plate, add some grilled chicken, and top it off with a little bit of Parmesan and some fresh parsley. Dinner will be done. And if you want to follow me right back over there, we're going to make this ready to go. All right, and now we're ready for the final touches. Add some chicken we grilled off a little while ago. Arrange that right on top of our pasta right here. And we'll finish that with a little bit of fresh Parmesan. And some fresh parsley. And here we have our garlic cream penne chicken pasta. Bon appetit.
Coming up Monday on the Morning Medical Update.
I remember the day vividly because it was something that kind of changed my life.
A Kansas City teen is one of 1 million youth athletes injured while on the field. I'm Jessica Lovell. You'll meet the team responsible for his care that got him back in the game. Join us live from Arrowhead Stadium Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.